Want to know how statins work and how they affect your work as a physical therapist? Stay tuned to hear all about it. Hi, my name is Hendrik and you're watching Fysiofarma. Today we're talking about statins and what they do. So what are statins? Well, they're a group of LDL cholesterol lowering medication, otherwise known as HMG-CoA reductase inhibitors. They block the forming of LDL cholesterol inside the liver by inhibiting the forming of methylonic acid out of HMG-CoA. Now, when the liver senses the decrease in LDL cholesterol, it will increase the amount of LDL receptors on the liver cells so it can absorb more LDL from the general circulation. Also, VLDL secretion will decrease while HDL blood level increases. Normally, about 75% of cholesterol is LDL and about 20% is HDL. The other 5% consists of VLDL and chylomicrons. LDL is what we call the bad cholesterol. When in high quantities, it causes arteriosclerosis, because this greasy stuff can get stuck on the lining of our arteries. And when plaque from these greasy obstacles break loose, they can block circulation down the line, potentially leading to heart attack or even stroke. HDL is what we call the good cholesterol. It protects against the harmful effects of LDL because it helps in the transport and destruction of free cholesterol molecules. Statins lessen the risk of cardiovascular disease, they lower the mortality in population with cardiovascular disease, and increase energy levels in people with cardiovascular disease. Regular side effects from statins include nausea, diarrhea, obstipation, stomachache, and headaches. In some cases, they can lead to liver or muscle problems. In the case of liver problems, we should look out for patients with yellow skin, changes to nails, stomach ache, a painful belly upon palpation, and dark-colored urine. Now, there are different kinds of muscle problems you can get from the use of statins. These range from muscle aches, muscle cramps, muscle weakness, to even muscle damage. The risk of muscle problems increase with age, and with the occurrence of muscle problems in the legs, the risk of falls also increase among the elderly, leading to inactivity and a further growing of a risk of falls. Fortunately, the side effects of statins disappear soon after you stop taking the medication. Alas, this is not always an option. A very serious form of muscle problems that can be attributed to statins is rhabdomyolysis. This is a form of advanced muscle damage, and it doesn't occur very often. But because this condition is possibly lethal, we should want to be able to recognize it when it does occur. The reason rhabdomyolysis is so dangerous is because of the large amounts of myoglobin within the circulation as a result of the muscle damage. The myoglobin damages the kidneys, which possibly can lead to kidney failure and even death. The signs of rhabdomyolysis are overall malaise, nausea and vomiting, fever, muscle ache, muscle weakness, red-colored urine, widespread pain, or pain in specific muscle groups, mostly the calves or the lower back. The ones most at risk are above 80, females, have comorbidities, have a small thin frame, are between surgeries, or use more kinds of medications. I hope you like what you saw, and if so, please click the like button. And if you really like what you saw, then press subscribe and hit the bell. Bye for now.